Health Talk, brought to you by Rapides Regional Medical Center. You may not have ever really thought about it, but there's something to those love songs where your heart skips a beat, or lyrics describing electrifying emotions. Each beat of your heart is put in motion thanks to an electrical signal sent from your heart muscle.
Heartbeat travels through a certain pathway in the heart. Sometimes you will have either more than one pathway that can make the electrical signals to go haywire. When you have conditions like hypertension, which is high blood pressure, or diabetes, for example, you can have scarring of the chambers of the heart. And that causes people to have palpitations, dizziness, or lightheadedness if their heart is super fast. They can have chest pain or pressure. Sometimes they have shortness of breath.
The good news is that patients can often be treated with medications, pacemakers, or implanted cardio defibrillators, but some require something a bit more specialized.
And the other option is ablation procedure, where we go inside the heart, we figure out where the short circuit is, or where the pathways actually are chaotic, and then we can get rid of them by burning that part of the heart muscle with this ablation catheter.
The procedure uses catheters inserted through the groin that then travel into the heart.
The ablation catheter heats up the tip. Sometimes we use other catheters that can cool the tip. Either way, we cause damage to the heart muscle, therefore the pathway gets disrupted and flows back to the normal pathway.
The biggest benefit, of course, is a return to a higher quality of life.
Of course, they have complete turnaround. They have a good quality of life after they have these procedures done, which is the most important thing for us as physicians.
For more information about cardiology services at Rapides Regional Medical Center, visit rapidesregional.com.